Welcome everyone. This is our fourth and final webinar that is part of the virtual occupational therapy conference that LSVT Global has been having this week. And we are so happy that you've joined us today. For all of you that have joined us for all of our webinars, we're thrilled and thank you. This particular webinar today is on evidence-based occupational and physical therapy treatment. And specifically, we are giving information for OT and PT students and university faculty as well. So we welcome you today. My name is Laura Gousset. I'm one of the LSVT BIG training and certification faculty and also Chief Clinical Officer of LSVT BIG for LSVT Global. And I'm joined by my colleague, Ms. Julia Wood, who's an occupational therapist and also part of our LSVT BIG training and certification faculty. And so we welcome you both today. We'll be hearing from both of us throughout the webinar, and we're just so glad that you've joined. Some disclosures: both myself and Julia receive lecture honorarium from LSVT Global. Julia is a consultant and I'm an employee, and we both have a non-financial relationship with LSVT Global as having a treatment preference for LSVT BIG. The plan for our webinar today is this. We'll be going over the development, the rationale, research, and practice of LSVT BIG, so you really know what LSVT BIG is in a nutshell. And we'll be also reviewing resources available for OT and PT students. In terms of logistics, right now, all of your microphones are muted, and that way there's not background noise from our various environments. You might hear a lawnmower going today in my environment, and maybe not. In your control panel, there are, I think, 5 different handouts. One is the slideshow from today's webinar, which you're welcome to download and save for your reference. We'll also be emailing this to you after the webinar as well. Then there are some handouts that are specific to students. We have our student research grant handout. We have a student informational flyer and a general flyer as well. And then lastly, we have a flyer which lists all of the webinars that we did this week as part of the virtual OT conference. You can find those recorded versions next week in our blog under the webinars tab. It's blog.lsvtglobal.com. Also, it mentions our online training discount in that flyer. So be sure and download all of them and look through them, save them for your records. I'll go through CEU information and questions in just a moment. And at the very end of the webinar, there should be a survey that will pop up. And if you wouldn't mind taking a couple of minutes and filling out that survey, we'd be most grateful. Information on CE activity as such: if you are a professional PT or OT or speech therapist that's joining us in our webinar today, please note that this webinar is not pre-approved or pre-registered for CEUs. However, many states allow for self-report. So if you would like us to email you a certificate, please just email us at webinars@lsvtglobal.com to request a certificate. Be sure to include your name, the name of the webinar that you listen to, and your profession type as well, so we can get that certificate to you. It might take us a week or two. Just know that we've had 4 webinars over the last 3 days and had hundreds and hundreds of people join us. So it might take us a little bit to catch up on that. If you're not sure if your state accepts non-registered CEUs, please do check with your state licensing board. And in order to receive CEU credit, you must attend for the full hour live of this webinar. There are a few ways that you'll be able to ask questions during our webinar. At any time, you can type your question into the control panel. You should see a little box for that. If you click on the arrow beside it, it'll open up and you can type your question in. We will stockpile those questions and answer as many as we can at the end of the webinar, but to keep the webinar flowing, we will save them until the end. Also, at the end of the webinar, you'll be able to ask your question out loud if you want to by clicking on the hand icon. So I'll review those instructions at the end of the webinar so that you have them fresh. At any time, you can email us at info@lsvtglobal.com. So these are the learning objectives for today's webinar. By the end of this webinar, we hope that you'll be able to differentiate LSVT BIG as one evidence-based approach for treatment of people with Parkinson's disease, and outline the LSVT BIG treatment protocol that targets functional changes and barriers to participation. Define how LSVT BIG can support learning and transition to clinical services for occupational therapy, and I'll say physical therapy students too. And lastly, explore the many options for training and certification in LSVT BIG for OT and PT students. So right now, it's said that 8 to 10 million people in the world are living with Parkinson's disease, but that is projected to double by 2040. It's been likened to actually a global pandemic, and I hate to use that term in light of what the world is suffering right now with the COVID-19. However, this is a different type of pandemic in that it's a neurodegenerative disease, obviously not an infectious disease, but still nonetheless growing quite rapidly around the world. To meet that need, we've been doing our best to train as many clinicians as possible in this specialized treatment technique for Parkinson's. So we've trained altogether now over 40,000 clinicians represented by 75 countries altogether in both LSVT Loud, the speech treatment, and LSVT BIG, the physical and occupational therapy treatment. Our mission as a company really is to reach people with Parkinson's, to empower them so that they can achieve their highest levels of function in regards to communication, their mobility, their independence with activities of daily living, and in other activities in daily life through these programs, LSVT Loud and LSVT BIG. For those of you not familiar with them, these are evidence-based treatment protocols that are based on over 25 years of research funded by the National Institutes of Health and have had years of clinical experience. LSVT Loud is the speech therapy, always delivered by certified clinicians, certified speech language pathologists and assistants in the LSVT Loud treatment technique, and LSVT BIG is a physical and occupational therapy, always delivered by certified PTs, PTAs, OTs, and CODAs in the LSVT BIG treatment protocol. What's unique about the LSVT programs is that they're always administered in an intensive manner to really challenge that impaired system. So the techniques are very specific to Parkinson's disease. And if you think back from your neuro classes in school, you learned about the bradykinesia and hypokinesia that's present universally in people with Parkinson's disease. So they, over time, gradually move smaller and slower in both gross motor activities and fine motor activities as well. They also have many non-motor symptoms. The one that we address most specifically with the LSVT programs is a kinesthetic awareness deficit or a sensory deficit. We'll be talking more about that in this webinar as well. So to just give you an example of some pre and post outcomes, I'll show you a video. You may have seen this one before, but I never grow tired of seeing it. This is a gentleman that was really in the moderate stages of Parkinson's. He's at what we call a Hoehn-Yahr stage 3, and he had already had Parkinson's disease for 14 years when he was referred to physical therapy because of problems with his walking, his balance. He was starting to have some falls and freezing of gait as well. His medications were optimized, and what you'll see is him walking out of his therapy appointment after the first day, and then on the right side of the screen, walking out of the therapy appointment on his last day of treatment just 4 weeks later. So just give me a minute to pull up this video, and there's no audio with it, so we'll just kind of walk through it together. Okay, so one of the things you might notice right away is that he's no longer using his cane 4 weeks later. You can also see that he's moving much faster. He has longer stride length, more arm swing bilaterally, a little bit of trunk rotation now. On the left side, you can see that he almost begins to freeze in that transition from the rug to the concrete and going through the doorway. And those are typical freezing triggers for people with Parkinson's disease. If we had left him unchecked without therapy, this would have continued to progress because of the progressive nature of the disease. But you can see that he's learned a technique to overcome that by learning how to move bigger in function. And this shows him improving in his walking, but if you knew a little bit more about him, you'd see how he was able to generate larger movements with all activities, whether it's transfers or even fine motor activities. All right, let me just stop that. He just keeps walking there. Okay, so objectively, some things that you might want to know about him is he actually went from about 30% of normal gait speed for his age to 100% normal gait speed for his age. So huge improvement, means that now he can keep up with his peers, keep up with his wife, and he was able to achieve his goals of being able to go out to the restaurants and being able to play with his grandkids and walk again in public with less fear falling and without that cane. So some nice improvements, and those are just a few highlights from his case. So there are three main features that distinguish the LSVT protocols. These are standardized, research-based specific protocols. The first is our target. So our target is amplitude. For LSVT BIG, it's amplitude of movement. So bigger movement to override that hypokinesia that's part of Parkinson's disease. For LSVT loud, it's amplitude of voice. So they also have a tendency to talk softly, and that becomes progressively worse as the disease progresses. The second of these is the mode. So our mode for LSVT BIG is intensive and high effort, and we know that it's necessary based on the principles of neuroplasticity and motor learning that you perhaps have learned a lot about so far in your school in terms of repetition and frequency, and we'll talk all about those in this webinar as well. And lastly, our goal is calibration. We know that in order to have lasting success, there are some underlying deficits related to the non-motor symptoms that we must address. One of them is a sensory perceptual problem. And we'll talk a little bit more about that today as well. So starting with target, it's nothing new to target amplitude in physical therapy and occupational therapy treatments for people with Parkinson's due to this underlying deficit of hypokinesia. But what's unique about LSVT BIG is that it's a single target. It's the main thing that we focus on. And yet we see that there's activation across the motor systems. And so many other things improve. A person might come in like Bernie did, walking with a flexed posture, very narrow base of support, small steps, reduced arm swing, etc. And through that cue of BIG, not only improves their amplitude of movement with stride length and arm swing, but also we see improvements in posture, trunk rotation, balance, speed of movement, etc. And these improvements have also been validated by research. So I'm going to show you another video. We've been talking a lot about walking, but this cue of amplitude, driving amplitude, also affects fine motor activity. So I'm going to show you a video of a gentleman learning how to use this effort and this increased amplitude to improve his ability to button his shirt. And this was an activity that was quite important to him because he wore button-down shirts every day for his job. So let's just take a look at this.
Good, and I want you to just kind of notice as you're watching Bob do his buttons, it's a very slow, small kind of movement that he's using to try and get those buttons through the buttonhole.
Yes, we do struggle.
And this can be a very frustrating thing for a lot of people, Bob. You're not alone in that. Does the top button tend to be one of the hardest ones for you?
Yes.
Okay, good, you got it though. All right. Let's do it. Ready? 1, 2, 3, go again.
Wow.
Really push it in hard. Nice.
About a third of the time.
You're right. Good job. Now go back in and close it like you're angry with it. Really push it in strong. Nice. How fast was that?
Even quicker.
Even quicker. You're right.
I haven't done a button that quick, and I don't know how long.
Good.
Okay, so it's a fun video, and it just shows you how using that cue of amplitude and effort can very rapidly change things for patients with Parkinson's when they're working on not only gross motor but fine motor activities as well. Now, for that to be a lasting change for Bob, he would have to practice that really hundreds of times to make that really implanted or imprinted in his brain as his new way of driving effort for buttoning. But it was very effective, and for him it's empowering because now he knows that he can do it. He doesn't have to use a button hook. He doesn't have to rely on his wife to help him with the buttons. He simply needs to drive the effort to a greater level than he was previously accustomed to using prior to having Parkinson's disease. The second of these key features of LSVT BIG is our mode is intensive and high effort. The way that we drive that is over the course of 1 month and within the session as well. So we have a minimum dosage that we have found to be very efficacious through years of research, first on LSVT loud and then on LSVT BIG for the last 15+ years. Our standardized dosage is 16 sessions delivered 4 consecutive days a week for 4 weeks. These are hour-long sessions. They're not group therapy, they're individualized one-on-one therapy because the type of feedback and functional activities that you provide to every patient is very, very individualized. The patient also has daily homework practice and daily carryover exercises all 30 days of the month. And so it helps patients to form new habits of exercising and to really get into a lifelong practice of habit. Many patients that we see that have Parkinson's have become sedentary or never were exercisers in the first place. And so it does take this repetition and intensity to form new habits, and it takes this repetition and intensity also to change patterns of movement to make these bigger movements more automatic or more habitual. So this mode of intensity really is reflected by current research on motor learning and on neuroplasticity as well. And we'll briefly just go over some of these key principles that drive brain change that can be found in numerous articles, some of which are referenced on the bottom of the slide here. Through the research, we know that intensive practice is important for brain change. In LSVT BIG, we drive amplitude, we increase repetitions over time, we add resistance and more balance challenges, we improve their accuracy, and so although we may be using the same core set of exercises, they're never easy. Even for a very high level patient that has very subtle symptoms, we keep them challenging. The second of these is complexity. We know that in order for the brain to continue to grow and have new synaptogenesis, we need to keep the environment enriched and progressively more challenging. Through LSVT BIG, we might do this through environmental enrichment, dual tasking, multitasking, etc., as they first gain the core skill of how to move more bigger, more normal amplitude and movement. The third is repetition. We know that brain change requires a lot of repetition. So we say don't practice until you get it right, practice until you can't get it wrong. And I think this is all very simple to understand when we think of ourselves and a skill that we might once have been really good at, stop practicing it, and now we've lost some of that skill. So for our patients, we say repeat, repeat, repeat. After you're done with LSVT BIG, continue to take your daily dose of medicine, which is your exercise, in addition to the medicine your doctor may have prescribed. The fourth of these is salience. Practicing rewarding tasks, things that are fun, things that are meaningful to a person, actually activates the circuit in your brain's basal ganglia, which is a form of neuroplasticity as well when that activity, that circuitry is activated. And so we really try hard to choose functional activities that are meaningful to the patient, not necessarily things that their spouse wants them to improve, but what drives them, because when they understand this link to how this is going to help me in things that I love, their motivation to practice is going to be much greater. The last of these that we'll mention today is specificity. So in LSVT BIG, we're always training the deficits, which is hypokinesia and Parkinson's disease. We also feel very strongly that it's important to treat our patients not as orthopedic patients, but actually as patients with a movement disorder. So the best way to train movement is to practice the actual movement. So instead of doing, knee extension strengthening exercises to help improve their ability to go from sit to stand, we recognize that the primary underlying deficit is not quad weakness, it's a lack of anterior forward weight shift as they're transitioning from sit to stand. And so we use that cue of amplitude, practicing the actual functional task to help them achieve those tasks more independently. So the LSVT programs adhere to all those principles of neuroplasticity that you're probably well versed from in your schooling. Our goal is calibration. We understand that in people with Parkinson's, there's a sensory kinesthetic deficit. They do not understand that their voices have become too soft, nor do they understand that their movement has become so slow and so small until perhaps you show them on videotape or they catch a glimpse of themselves in a mirror. And when you first get them moving bigger and you're saying to them, bravo, it looks amazing, you're doing so great, walk like that all the time, reach for the cupboard all the time like that, the patient feels like it's exaggerated. Then they might just think, I can't do this in public. People will think I'm crazy. And so it takes a lot of feedback, a lot of repetition over the course of that 1 month to convince the patient that these bigger movements are in doubt, actually more normal, and that they become more comfortable using them over time as well. So the way that we achieve calibration primarily is by addressing these key non-motor symptoms. And there's a range of non-motor symptoms in Parkinson's disease. It's much more than just a motor disorder. In fact, these non-motor symptoms can be even more disabling than the motor disorder for people with Parkinson's disease. The ones that we really focus on are the changes in higher cognitive function by using a simple redundant cue of think big. So we don't teach different procedures for this is how you get out on your pants, this is for how you get off the toilet, this is for how you get in and out of bed. It's whatever you do, think big. We address the emotional changes of anxiety and apathy by really being empowering and choosing activities that are salient to our patients to drive their motivation. And lastly, through the sensory change, we might be giving them feedback very frequently about, did you feel that effort? Did you feel those big hands? Did you feel that big posture? That's the kind of posture, that's the kind of movement that's more normal, that's the kind of movement that you need to use in your function, and it looks excellent. So this is kind of our treatment focus in a nutshell. A person comes in with reduced amplitude because of reduced motor output. And so through treatment, we really drive them to increase their motor output by producing larger movements. On top of that, we work on improving their awareness of amplitude required to produce normal movement. So that's through that feedback, both visually, verbally, etc., that we give them. And then also through repetition of practice, we help them to improve their ability to self-cue, pay attention to their movement, so that they can not only detect the error in their movement, but independently correct the error in their movement. So we work to improve that broken internal cueing mechanism whenever we can. So I'm going to turn it over to Julia now, who is going to walk you through what the treatment protocol actually looks like.
Thanks, Laura. Great job. And thank you so much to everybody for joining us on this Saturday. I think it's great to have so many OTs tuning in, and we're kind of getting a little mini AOTA that we all missed out on. It would have been great to have seen you in person, but it's great to see you virtually as well. All right, so let's take a look at this treatment protocol. So the thing that I love so much about this, and I think the misconception often when I talk to OTs, is that it's assumed that LSVT BIG is just an exercise program. So I've had people say, well, this is just for PTs, right? Because it's just exercises. So you'll notice there on the left-hand side of the screen, the maximal daily exercises, there's 7 of them. We're going to take a little look at that today. And those don't change, as Laura mentioned. So every patient is going to do these exercises. But the way that we individualize it is every patient may do them a little bit differently as far as balance challenges or adding cognitive dual task or number of repetitions or intensity with those, is adding weights or resistance or different challenges to that. But then you'll also notice down here on the right-hand side, and this as an OT is my bread and butter, and I'm sure you all will feel the same way, it's these functional tasks. So this is where we truly individualize the program. So they're going to be choosing, and the patient chooses these. Sit to stand is always one of them, and how we do that varies individual to individual. But if you're, the person that you're treating is having difficulty getting their keys out of their pocket, using their cell phone, buttoning their shirt, like you saw Bob earlier, getting a shirt on, doing a button. These tasks are going to be involved in their carryover task or their hierarchies. So their functional components, their hierarchies, and then that'll even go home with them in their carryover exercises. So they're going to be going and doing their homework every day, doing all of their exercises, doing those functional component tasks that are those simple tasks, doing those carryover exercises that you give them. So what you're practicing in the clinic really walks out the door with them and follows them into their real life. And they start to really see what this can do for them functionally, the improvements, and then you get that buy-in and that compliance that we're all really looking for. All right, so those core exercises are really your building blocks, right? So you're looking at training them how to perceive those bigger movements. But then it's practicing that larger amplitude in those functional tasks, which are important to them, that really gets the buy-in. They're able to see what this does for them, for their quality of life, for their daily function, for their independence and their participation. So these are some examples here of what the exercises look like. You'll notice that the first 2 exercises are seated, and then the others are standing. The big thing to notice, though, is really look at the amplitude with them. Look at how big the hands are. The posture's big, the rotation of the trunk, everything in the movements looks very dynamic, right? But also think about it. Think about how functional these are as well. So that big posture you see in that first exercise where she's seated with the hands open, that's what people need to work on for when they're sitting and eating or sitting at their desk and typing or sitting and talking with people. That big reach that she's got in the next one where we're focusing on some hip extension and really reaching, having people be able to reach up into the counter or up into the cabinet to get things, being able to rotate even and get to their seat belts. The stepping exercises that you notice there, taking that big forward step to step over the edge of a bathtub or step up onto a curb, being able to take a step backward safely so that they can get out of the path of an elevator, taking that big side step that you see on the bottom of the screen to move in the kitchen or to be able to turn to get out of their bathroom. And then those multi-directional exercises there with the rocking and reaching really help support balance, stability, gait, trunk rotation. So even though they might be a set of, quote, exercises, they really do target the functional changes that we see with Parkinson's and help support participation and independence. So we're going to show a little video of an exercise demo here so you can see what they look like. I believe there won't be any sound on these as well. If I need to talk you through it, I will.
So you're going to do what I do. Ready? Big reach. Good. Now big hands for me, Bob. Nice. Down big, up, and back big. And we're going to hold for a 1, 2, 3, big posture, 4, 5, 6, 7, 8, 9, 10, big finish. Ready? Big step. Good. And back big. Nice. Step and back. good. Get that foot all the way back. Back, good. Step and back.
Yes.
Big reach and up. Beautiful, that was much better. Big reach and down. Good, again, big reach, up, big reach, down. Again, reach, good, down. One more, big reach, and back down. Good.
Excellent. So you could see in those two that therapeutic use of self, right? So Jenny really had such a great affect. She was really driving and motivating Bob with her presence, with her smile, with her affect. So our therapeutic use of self, which we've all been trained so effectively in as occupational therapists, really helps get that output. So you'll notice here, think about what you just witnessed in the video. So that drive, we're trying to really drive that motor output, override those small and slow movements so that the movements become more normal. And this is, during their activities of daily living, when they're walking, during functional mobility. And we want them to really learn how it feels to have the right amount of that effort for those movements. So that's where she was like, that was it. Great. Do it just like that again. Because ultimately we want to improve not only their gross motor, but their fine motor coordination. You notice with the standing and stepping exercises, balance is involved. There's a lot of work on functional strength when we're doing that sit to stand. Flexibility, we didn't show the back step, but definitely that gets into a little hamstring flexibility. There's hip flexibility, and then even their functional endurance and their activity tolerance. And I have to say, fatigue is something that is a big problem as far as non-motor symptoms for our individuals with Parkinson's. And I've had great success with this program in really helping people improve their activity tolerance during the day and improve their fatigue. Okay, so let's take a look here. If we're thinking about how these generalize to those activities in life, if we've got them doing this big rock and reach like Jenny's doing there on the left-hand side, that really is going to support their balance, their stability, the amplitude and drive of their movement so that they can get things off of shelves, get their clothing in and out of the closet, maybe reach for things in their kitchen cabinets. So these really do help their daily function. And they should always be personalized to the person. So I'm not going to do buttoning with every individual that comes in, right? Or donning socks. It should be personalized to the person, whatever it is that's salient to them when they come in. And I maybe do my Canadian Occupational Performance Measure or my PSFS, my patient specific functional scale, or just set those goals. What is meaningful to the individual? What do they want to be able to do? That's what's going to be most important. So we really want this to be individualized and salient to the person. So we're going to select those goals based on our evaluation. We're going to assign those 5 functional component tasks that they really select. We're going to choose 1 to 3 hierarchies, which are more complex tasks. So like the act of putting on a pair of pants versus just threading a leg into the pants or just buttoning the pants. So we're talking about more complex tasks. And then over the course of that month of therapy, they'll have 30 carryover tasks. So every single day of the month, you'll choose something for them that they're to take out of the clinic, like opening the door in a big way, or sitting big at the restaurant when they eat dinner. So these functional component tasks are always patient-driven. They're going to be simple components, very simple kind of one-step exercises or activities. So the first one is always sit to stand. Other examples that we give here, opening a door, or opening a bottle, pulling up a zipper, closing a button, pulling your keys out of your pocket. So things that are kind of simple, but once again, they should always be selected by the patient, not necessarily chosen by us. And we know that even fine motor tasks become too small in people with Parkinson's. So part of it is that coordination too and driving the movement to continue to brush teeth or stir or whisk food when they're cooking. So our goal is to scale them up to normal so that they can continue to perform whatever those meaningful tasks are independently, efficiently, and safely so that they can continue to participate in the things in life that are meaningful to them. So our hierarchy task examples, as I mentioned, these are things that are more complex. So they're going to have more steps. And if you think about motor learning over the course of the 4 weeks that you're working with that individual, you're going to be gradually building up to doing the entire task, kind of practicing it in those blocked practice components. And I feel like for my students, this is always really helpful for them to kind of grasp motor learning in real time and think about how to approach it with their clients. So things like getting dressed, taking a bath, doing toileting, handwriting, tennis, gardening. These are all things that have more steps, right? And we're going to really look at where are the problem points for that person. You know, is it bending? Is it reaching? Is it grasp? Is it manipulation? And then gradually build the complexity of that task until they're doing it full out at 4 weeks with that large amplitude. So we have a video example here of bed mobility, one of those hierarchy examples.
You're ready.
Ready?
Yep.
Cool. Yeah. Oh, the immersion? Yeah, the immersion. When are you going to do it? In April? Yeah. You might.
Okay. Is that pretty good?
Mm-hmm. Yep. All right, now go ahead and get out of bed.
You can probably practice that. Yeah, then I'll see it when you do it. Immersion was great. You know,
Go ahead.
Ready?
Yep.
All right.
All right, so in that video example today, we kind of got to see essentially right the start and the finish. We didn't get to see the 3 weeks in between, but you could really see the change in the amplitude with his movement. And I always like to point out, because that's a gentleman from our clinic, that the little flare with the arm at the end, he added that in himself. We didn't actually teach him that. So that was his own application of amplitude. But you could see in the beginning how difficult that was, how slow it was, all the movements were really small and inefficient. And so if you think about breaking that down over the 4 weeks, working on the different sections and segments of that and doing some block practice, by the end of the 4 weeks, how much different that looked and how much more efficient and independent that was for that individual. So the hierarchy considerations, always our goal is calibration. So, you know, it's one thing for me to cue and me to teach someone how to do it, but I really want them to start to self-critique so that they're engaged and feeling and solving that sensory processing problem for themselves. So, you know, in the beginning, when we're first teaching someone these exercises and teaching the hierarchies, we're more cueing and commanding. By the end, you know, I'm asking them, what do you think you need to do to make that better? What could you have done? Was that your high effort to get out of the chair? A great moment for me is always if I go to get one of my clients, say week 3, week 4, from the waiting room, and they get up from the chair and they go, that was not my big sit to stand. And they sit back down and they do it again the right way, because then we're starting to go out of the treatment room with them, and all of that great practice and learning, you know, they're not just performing for us anymore. It's actually made some functional change. So what about walking big? It's really important to note here. Sometimes we get a little pushback from OTs that I can't do big walking. You know, I'm an occupational therapist. That's for PTs to do. But functional mobility, right, it's part of our ADLs. People have to walk to the bathroom. They have to, you know, walk to get their clothing from the closet. So it has to be a part of every session, whether it's physical therapy that's leading the session or an occupational therapist. And the goal is for them to walk with more normal amplitude. So their posture is big. We want appropriate step length and arm swing. everywhere that they go, be it in their home, be it in their work task or their play task. Now, how I address this might be a little different than physical therapy. I'm not really looking at heel strike through toe off, right? But I might be looking that their base of support is wide, that they're lifting their feet so they don't trip over things, that they're keeping their posture up, and they're aware of that, no matter if the distance is short or longer. And we also are going to look at varying the environment and the functional purpose. So for me, I might really be targeting some environmental challenges they have in their home, for example, and looking at what that walk is like from the bed to the bathroom, maybe at night, in different lighting situations, where PT maybe is focusing more on it outside, looking at navigating the outside curbs and sidewalk changes and whatnot. So the carryover exercises, these are so important. It's like a daily homework assignment for them to really use those big movements in real life outside of the treatment session. And this is where I feel the magic really happens with this program. And just like the difficulty of the exercises and functional components should change across the 4 weeks of treatment so that we keep that individual engaged and challenged, so should the complexity of the carryover assignments. They should be very specific, and the patient should be made accountable for doing them. Sometimes I have people email me later and tell me how it went, or sometimes if handwriting is part of it, they have to kind of write down how it went, or I want to hear from their care partner or family some support. So an example here at the bottom is when you leave the clinic, I want you to walk big to your car with your spouse. Walk big enough that they comment about your walking. And then I always let them know, I can't wait to hear how this goes tomorrow. I want them to know that I'm going to be checking in on them and seeing how it went. So our treatment goal is that these people with Parkinson's will use their bigger movements automatically in everyday living, and that there's a long-term carryover of that increased amplitude use. The last thing we want is that this is just 4 weeks of exercise and then it's gone. So we want this to really change how they feel and perceive their movements in their everyday life. So there's a lot of research to support LSVT Loud and LSVT Big. As Laura mentioned earlier, these have been researched over the last 30 years with funding from the National Institutes of Health. It's important to note that LSVT Loud is the only speech treatment for Parkinson's disease that has level 1 evidence and established efficacy for treating voice and speech disorders, and the application of other neurological disorders. There have been 3 randomized controlled trials and numerous other studies that have supported this mode of training for people with Parkinson's. And LSVT BIG has come about as kind of the sister program for physical and occupational therapists, and it was developed based on this concept from LSVT Loud of amplitude to the voice. We've applied that amplitude now to movement, and we are getting more and more research. We have 2 randomized control trials and other small studies, and the research is ongoing and continuing. And that's something you can always look to our website and see how you could be part of that possibly in the future. So this is one of the bigger studies that we have, the Berlin LSVT BIG study, which actually compared LSVT BIG to a walking program and then also a home exercise program. It's important to note that the UPDRS motor score, that is an exam typically that a movement disorder specialist does, and lower scores represent improvement or more change. So you can see here that the dotted line, right, is the LSVT BIG. And so you'll notice that change in baseline from week 16, BIG had a much bigger change. You really see that dotted line drop compared to the walking, which is the small dotted line. I guess I should actually say BIG is kind of the dashed line. Walking is more those small dots, and the home program is that solid line. And you see how those, they kind of hovered in the same arena, but LSVT BIG, there was really that big improvement in the UPDRS score across those 16 sessions. So training amplitude, we know, further enhances other levels of motor output. So studies have looked at kind of what we call these cross-system effects that happen. So we definitely see improved trunk rotation, better stride length in their stepping. Their speed of movement is definitely improved. And I have to say, you see this not only in gait speed, but also in tests like the 9-hole peg test or box and blocks, things like that that we look at. Their reaction time is improved. We noticed on the Berlin study that improvement in their UPDRS motor score. We've also been able to chart better balance and improved coordination and activities of daily living. They improve their ability to dual task. And this we know with Parkinson's is definitely challenging, doing more than one thing at a time and kind of challenging the brain and body to move differently. And their occupational performance overall has been improved. So the studies are cited there at the bottom. You can take a look at these and really see all of the great things that we're seeing happen with this training. So some references for you, you'll notice on our website, if you go to lsvtglobal.com/research, we've got a great list of references that you can look up and see for yourself, kind of read these articles, or, if you want to do a little bit more of a lit review for a class or whatnot. And I think evidence-based practice is always so important. And I love reading research articles and really being able to then kind of translate that for my patients as well, to defend why we're doing what we're doing and how this is going to help them. And I think with that, I'm turning it back over to Laura.
Yes, thank you, Julia. That was a great overview of the LSVT protocol. In this last bit of the webinar, we really want to share information with you on how to get certified. And through conversations we've had with thousands of students over the years, we realized that a lot of students don't know that they can get certified as a student. So that's your big aha moment right now, perhaps, is yes, you can actually take this continuing education course as a student, and you can take it either online or you can participate in a live 2-day training and certification course. On our website, there's a lot of information on both options. If you go to lsvtglobal.com, there's a big orange button at the top that looks just like this one that says Get LSVT Certified. Once you click that, you click your profession type, and then it'll walk you down the path and teach you about both the online and the live options, and then take you to a place where you can register for either course. For students, there's a lot of benefits in taking this training now as a student rather than waiting until you've graduated and are a working professional. Like Julie and I said, it really does reinforce the motor learning and neuroplasticity concepts that you've learned in school, but not only that, it teaches you how to apply those concepts. And I think myself as a professional, that was really valuable to me, is, it takes it from theoretical, conceptual to something I know how to apply using this evidence-based framework. If you're certified as a student, you can use it under the supervision of an LSVT BIG certified therapist of the same discipline while you're on your field work or your clinical affiliations. Also, if your university participates in research and you have a treatment research study going on about LSVT BIG, getting certified enables you to participate in that research study. And we have a number of universities that have already done so. And it's a great thing for students to be able to participate in. And lastly, we do feel that it will enhance your marketability by putting the certification on your resume when you're job hunting, specifically for jobs in the geriatric or neuro arena. And it gives you this solid foundation and a confidence that, hey, I've got this treatment tool that I know how to do, and I know it really works as you launch your career. So let's talk about the online training first, some quick facts about that. The content is exactly the same as the live course. It's a self-paced course, so it's a pre-recorded PowerPoint presentation that you can do on your own. Currently, we give you 90 days to complete the course, and it takes about 16 hours altogether. So you can power through it all in one weekend, or you can piece it out over time, and it's very popular with students with your crazy schedules, and also eliminates the need to travel and spend money on hotel, etc., of going to a live course. You get the same materials, everything's downloadable, but we also actually ship a binder kit to you. So you'll get a binder, a DVD, bag, the whole kit that you get at the live course. One of the new things that we're doing right now is also offering weekly office hours via Zoom. So for anyone enrolled in our live courses, if you want to do a check-in, it's optional, and chat with the instructors on a weekly basis, maybe say, hey, am I doing these exercises right? We can see you on video if you choose and give you feedback that way. So for your university, there's a couple of different options. One, you can simply do the training on your own anytime, fitting it into your own schedule. But we have had a number of universities over the last 5 years that have taken this course and offered it to a group of students that are interested in taking it together. It's really fun because it enables you then to practice with each other, much like you would in a live course. A lot of the faculty also offer an additional lab, sometimes bringing in participants with Parkinson's from the community, so you can have some hands-on practice that way. Students can organize it together, but typically there's a faculty involved that helps to organize that as well. You can complete the full course together. You can complete part of it together and part of it on your own. So there's lots of different options. And in your handouts today, there's one on group learning options. If this is something that you might be interested in for your university, download that, and I'm the point of contact for that. Love to chat with you and give you some more information on how that might work and the discounts that are available for both students and faculty. We take care of everything with those groups. We send out registration instructions. We ship the course materials to everyone. We chat with the facilitator to make sure that they know how to run the online course if you're doing it in a group setting. We do a Q&A session optional afterwards to answer any questions that you might have, and we provide tech support as well so that it goes well. This is just a quote from one of the professors actually at Creighton University that has provided this training for the last 5 years. And she said, partnering with LSVT Global to offer the students the online training and certification course was definitely a value-added experience. For our program, students were able to supplement their knowledge and skills from our curriculum with cutting-edge clinical skills that they could immediately apply. Upon graduation, their certification gave them a highly desirable marketing edge with employers. And so this is a quote that we share because we hear it frequently from other faculty and students as a really positive thing. And that's what we're there for, is to help train up students, give them the solid tool so that you can go out and hopefully over the course of your careers impact many, many people with Parkinson's and other neurological disorders through this effective treatment. You can also go to a live course. We have in-person courses throughout the United States. They're 2-day long. They're usually Saturday, Sundays, occasionally Friday, Saturdays. We do have a limited number of student spots available, but the price is reduced. The normal professional price is $580. It's only $300 per student, and there is a group rate. So if there's one upcoming, you're welcome to register for that as well. But I advise you not to wait too long because our courses do tend to sell out. After you're trained, a lot of students wonder, do I have to retake the course? Do I have to retake the exam? No, all you have to do is contact us and say, hey, I graduated, I'm licensed, here's a copy of my diploma. We'll upgrade you for free to professional status, and then you can be listed on the clinician directory. While you're still a student, like I said, you can utilize LSVT BIG under the supervision of an LSVT BIG certified clinical instructor of your same profession, as long as that is in accordance with your State Practice Act. We also have something called certification renewal every 2 years from the date that you got certified. So your certification date is the date you passed the certification exam. That's built into the course. So 2 years from now, or from that date, we would email you and say, hey, it's time for your renewal. It's a short online course. It's 2 hours. It's $50 that will update you on all the latest research, review core principles, and help to keep you active in your clinician account and keep you listed on the clinician directory as well. After you're certified, you'll have access to a library of over 40 on-demand webinars, monthly live webinars, videos, access to our faculty for ongoing questions, We have a Facebook group and a lot more that goes with that. If you're interested in doing research, we offer student research grants every year. So right now we have two $1,500 grants available for OT students and two $1,500 grants available to PT students for the coming academic year. These grants are meant for students that are involved in treatment research and neurological populations. It doesn't have to be Parkinson's, it doesn't have to be LSVT BIG, it's very broad, but it does have to be behavioral treatment research. I've added a handout to this webinar that talks about those call for proposals, but you can also email our grants manager, Geraldine Schultz, at lsvtglobal.com for more information. And this spring, we're actually taking applications, so you still do have time to submit your proposals and have a really good chance actually of being awarded that. If you're interested in participating in research yourself as a student, if it's treatment research, you do have to get certified and treat at least 3 patients if they're participants in the research study. Some opportunities to learn more. We have a lot of information on our website. We do have an information specific to students and faculty that you might be interested in. We also have a lot of information on our blog. So you literally could spend hours on our website learning. But if there's anything that we can do, feel free to contact us personally as well. And we're happy to give you information and answer any questions that you have. So in summary, the LSVT programs you've learned target the sensory motor changes in Parkinson's disease to improve function, increase participation, improve quality of life for people with PD. OT and PT students can maximize the understanding of these motor learning concepts, gain hands-on experience, and obtain a marketing edge with training and certification LSVT BIG. LSVT BIG provides an evidence-based standardized protocol that's individualized. I hope you understood that also from Julia, to provide a patient-centered, task-specific approach to treatment. And certification can be performed in person, online, individually, or as a group in your academic setting. Before we take questions, I just love to share this quote of this gentleman that received both LSVT Loud and LSVT BIG, and he said, "More than 1 year later, I still continue my exercises almost daily. I have the confidence in my body to continue doing the things I love: gardening, walking with my wife, spending time with my family, traveling, reading poetry on the radio. Parkinson's is my enemy, but thanks to the LSVT programs, I will prevail." And students, I can tell you that it's really the most rewarding treatment that I personally have been able to offer to my patients, to give them this gift of participating in the functional things in their life that are meaningful to them, that make their life joyful and happy and worthwhile. And it's the greatest reward as a therapist to be able to give that gift to your patients. So we're going to take a few minutes and ask questions. We are close to the hour, and so if you need to go, get back to your busy Saturday, you're welcome to go now. Just remember to fill out the survey and to email webinars@lsvtglobal.com if you want a certificate. If you want to stay, we would love for you to stay and ask questions, listen to questions for the next 5 or 10 minutes. So to review how to ask those questions, you can type them in your control panel. You can raise your hand. That means you want to ask your question out loud. In order to do that, you're going to have to unmute your microphone on your computer, and then we will unmute your microphone as well, so that you know that it's your turn. So let's start with the questions that have been typed in so far. And thank you all for typing in those questions. Can a PTA become certified? Yes, a PTA can become LSVT BIG certified, as can a CODA become LSVT BIG certified. Just know that when you're practicing, delivering LSVT BIG, it needs to be paired with a PT or an OT. So if you're a PTA, you need to have a PT that's also LSVT BIG certified. That therapist, whether they're an OT or PT, will be the one to evaluate the patient, determine if they're a good candidate appropriate for LSVT BIG, and then set the plan of care, the functional component task, the hierarchy that's very specific to LSVT BIG. Also being able to monitor them adapt, change things as needed with exercises. But it can be a great team and really helps with scheduling flexibility as well to have both assistant and therapist certified. And I think I answered another question very similar about I'm a CODA and want to deliver it with an OT as well. All right, Julia, do you want to take this one? Can you explain the physiology, the why behind the finish big with the slap on the thighs?
Oh, that's a great question. So what typically happens in Parkinson's too is we didn't get into this as much, is the go, no go signal is what we call it, is affected in the brain. So the initiation of movement can be a problem, but then also the termination of movement. So that's where you see issues with freezing of gait, right? They might have a start hesitation where they start to move and they can't really get their movement going, or festination can happen also where it's like their movement's like a runaway train. So the big start and the big finish are to really train that clarity in movement so that they know to initiate their movements in a big way, but then also finish and complete their movements in a big way. In our clinic, an example that we give, and my colleague Heather Cianci has always said this, she said with Parkinson's, people's movements become like a run-on sentence, and we have to teach them where to put the punctuation in. So that's kind of where that big slap and that big finish comes in. So great question.
Okay, thanks. And I think there might be someone who has their hand raised. So just give me a moment here to scroll up and see who that is. And it looks like it's Renee Gilbertson. Do you have a question that you want to ask? It looks like you're self-muted right now. So unmute your microphone. I'll just give you a minute here, Renee, if you have a question that you want to ask. Okay, we'll move on to the next person then. Jocelyn Burgos, do you have a question that you want to ask? And same thing, Jocelyn, if you can unmute your microphone, you can ask your question out loud. Okay, all right. So maybe it was, sometimes I think people might hit these icons accidentally, and that's okay too. You can always email your question in after if you think of it at info@lsvtglobal.com. So with that, it looks like we have no more questions. Again, we're just so thankful that you joined us today. We hope this information was useful to you. We will be following up with an email next week and a certificate in the next couple of weeks for you if you want to report for CEUs. And Julia, can you hang on for one more question that just came in at the last minute?
Sure.
Okay, do you combine LSVT BIG in the plan of care with other interventions?
Typically no. So if you're wondering, do we do like a side program? I'm assuming this is your question of like some strengthening or other range of motion exercises. No. So it takes so long. I mean, it is a jam-packed hour to get through all of your exercises in every session, your functional component task, 5 of each of all of those, your hierarchy task, your big walking, and you have to assign a carryover. And what I find too is you typically don't need it. Now, let's say I'm going to play devil's advocate for a second. Let's say someone is really having rotator cuff problems, right? And this has happened before. We had a gentleman even that fell during the course of his program because he slipped on the ice outside. And so we had to sideline the program for a bit and let him deal with that issue that was more pressing. And then he returned and we finished up his protocol at the end. But for your just typically addressing the functional challenges, the mobility challenges, establishing an exercise program, I find they don't really need anything else unless there's something, that really comes into play as far as an injury or incident during the program. Would you agree, Laura?
Yes, I think that's spot on. All right, and the very last question, and then we will wrap it up. CPT codes, which ones do you bill Julia?
Oh yeah, so typically, definitely therapeutic exercise. When we get more into, and that's for your, the half of the session where I'm doing the exercise components. If I start to add a lot of balance challenges or different, uneven surfaces or things like that, then a lot of times I get more into like neuromuscular reeducation billing. For their functional component tasks, depending on what they are, therapeutic activity is a great code for that. If it's a very ADL driven task, like say I'm working on dressing or cutting food or bringing a utensil to the mouth, then I might even bill for self-care.
Okay, thanks. And it would be very similar for PT. We typically build neuromuscular reeducation, sometimes therapeutic exercise, gait training, and therapeutic activity. All right, so with that, again, we just thank you so much for joining us. This webinar has been recorded and will be available on demand on our blog next week, and enjoy the rest of your weekend.
Thank you all.